Hey everyone, and welcome back to the channel. Today, we're diving into a topic that's incredibly important for all of us, no matter our age: heart health. Your heart is an amazing organ, working tirelessly every second of every day. But sometimes it sends out subtle signals when it's in trouble. Ignoring these early signs can lead to serious problems down the road. So, in this video, we're going to talk about the early warnings of heart disease that you should absolutely never ignore. Think of this as a friendly heads-up, a way to become more in tune with your body. Let's start with one of the most well-known signs, but with a twist: chest discomfort. Now, we're not always talking about the dramatic, crushing chest pain you see in movies. For many, it's more of a subtle pressure, a squeezing, a fullness, or a mild ache in the center of the chest. It might last for a few minutes, go away, and then come back. It can happen when you're resting or when you're active. The key takeaway here is that any new or unexplained discomfort in your chest area warrants a conversation with your doctor. Don't just brush it off as indigestion or a pulled muscle, especially if it keeps happening. It's always better to be safe and get it checked out. Next up, let's talk about something you might not immediately connect to your heart: pain that spreads to your arm. This is a classic symptom, particularly pain radiating down the left arm. However, it's not always the left arm. The pain can also travel to your neck, jaw, back, or even your stomach. It might feel like a dull ache or a sharp pain. The reason this happens is because the nerves from your heart and these other body parts send signals to the same area of your brain. Your brain can get confused about the source of the pain. So if you're experiencing this kind of radiating discomfort along with chest pressure, it's a major red flag. Now for a sign that often gets overlooked, especially by women: unusual fatigue. We all get tired, right? Life is busy. But the fatigue associated with heart issues is different. It's a profound, heavy exhaustion that comes on suddenly. You might feel wiped out after doing something simple that you normally handle with ease, like climbing a flight of stairs or carrying groceries. It's the kind of tired that doesn't get better with a good night's sleep. This happens because your heart is struggling to pump blood effectively. So your body diverts blood away from less vital areas like your muscles and limbs to support the heart, leaving you feeling completely drained. If you're suddenly feeling overwhelmingly tired for no clear reason, pay attention. Let's move on to shortness of breath. Feeling a little winded after a hard workout is normal. But feeling breathless after minimal exertion, like walking to your car or even while you're just sitting down, is not. This can happen with or without chest discomfort. When your heart can't pump blood efficiently, blood can back up in the veins that go from your lungs to your heart. This can cause fluid to leak into your lungs, making it difficult to breathe. You might also notice it as worse when you lie down and gets better when you sit up. This is a serious sign that your heart is under strain. Another subtle clue can be found in your lower body: swelling in your feet, ankles, legs, or even your abdomen. This condition is called edema. When your heart doesn't have enough pumping power, blood flow slows down and backs up in the veins in your lower extremities. This causes fluid to build up in the tissues. You might notice your shoes feel tighter, or you can press a finger into your skin and the indentation stays for a few seconds. While many things can cause swelling, if it's new and persistent, it could be your heart signaling for help. Here's one you might find surprising: dizziness or lightheadedness. Feeling a bit dizzy now and then can be caused by dehydration or getting up too fast. But if you're frequently feeling unsteady on your feet, lightheaded, or like you're about to faint, it could be related to your heart. These feelings can be caused by a drop in blood pressure because your heart isn't able to pump as strongly as it should. Or it could be due to an irregular heartbeat, also known as an arrhythmia. Don't just dismiss it as one of those things. Consistent dizziness is worth investigating. Next, let's discuss heart palpitations. This is the sensation that your heart is racing, fluttering, pounding, or skipping beats. It can feel a little scary, like a fish flopping around in your chest. While things like stress, caffeine, or anxiety can cause temporary palpitations, if they're happening often, last for more than a few seconds, or are accompanied by other symptoms like dizziness or shortness of breath, it could indicate an underlying heart problem. An irregular heartbeat can affect your heart's ability to pump blood efficiently, so it's important to get it evaluated. Let's also touch on some less common but still important signs. Persistent coughing or wheezing that produces a white or pinkish mucus can be a sign of heart failure. This is due to fluid building up in the lungs, as we mentioned earlier. Another one is nausea, indigestion, or stomach pain. While usually related to something you ate, these digestive issues can sometimes signal a heart problem, especially in women. Your body is a complex, interconnected system, and a problem in one area can show up in a completely different place. So what should you do if you experience any of these signs? The most important thing is not to panic, but also not to ignore it. Don't try to self-diagnose or wait for it to go away on its own. Your best course of action is to schedule an appointment with your doctor or a cardiologist. They can perform simple tests like an EKG or a blood test to see what is going on. Early detection is a game changer when it comes to heart disease. The sooner you know, the sooner you can start making lifestyle changes or begin treatment, which can dramatically improve your outcome. Remember, you are your own best advocate for your health. Being aware of these signs empowers you to take control. A healthy lifestyle, eating a balanced diet, getting regular exercise, managing stress, and not smoking is your best defense. But knowing the early warnings is your safety net. If something feels off, trust your gut. It's always better to get checked and find out it's nothing, than to wait and find out it's something serious. Thank you so much for watching today. I hope this information was helpful and empowers you to listen more closely to your body. If you found this video valuable, please give it a thumbs up, subscribe to the channel, and hit that notification bell so you don't miss our future videos. Stay safe, stay healthy, and we'll see you in the next one.